stop right now. Before you schedule your next routine medical test, I need you to do something. Think about the last time a doctor said, let's just run this to be safe. Did your stomach tighten? Did your mind race to worst case scenarios? That reaction, that immediate fear response is exactly where the problem starts. Because here's what most people over 60 don't realize. The biggest threat to your health isn't always the disease you might have. Sometimes it's the test itself. And what I'm about to share with you will change how you think about medical screening forever. Stay with me because by the end of this video, you'll never agree to a test blindly again. I'm Dr. Megan Foster. I've spent 24 years in surgical medicine, and I'm going to say something that might shock you. Some routine medical tests are causing more harm than good in healthy adults over 60. We've been taught that more screening equals more prevention, that more detection means longer life. But what if I told you the real danger isn't missing disease? What if the real danger is finding things that were never going to hurt you in the first place? There's a hidden mechanism behind this that most patients, and honestly many doctors, never stop to question. The medical field has evolved dramatically over the past few decades. We can now see things we never could before. We have scanners that can detect nodules the size of a grain of rice. We have blood tests that can pick up tiny variations in your body chemistry. This sounds like progress, and in many ways it is. But there's a dark side to this technology that nobody warned us about. Think back 20 or 30 years. You went to the doctor because something hurt. You had actual symptoms, a real problem you could feel. Now, you can feel completely fine and still leave an appointment feeling like something might be wrong. Maybe you went in for a just-in-case scan before a big vacation. Maybe it was a routine pre-surgery test. Maybe your kids insisted on a memory check because you forgot where you parked your car once. You walked in feeling confident. You walked out labeled, worried, scheduled for follow-up appointments you never expected. That shift from healthy to monitoring something changes people at a fundamental level, even when nothing is actually wrong. I've watched it happen hundreds of times in my practice. A person's entire demeanor changes. Their confidence drops. They start second-guessing their body. They become hyper-vigilant about every small sensation. And here's what you need to understand. That spiral isn't inevitable. Aging doesn't require endless testing. It requires smart decision-making. When you understand how the testing cascade works, you can avoid being pulled into it unnecessarily. But first, you need to see the mechanism clearly. Imagine pulling a loose thread on a sweater. You tug one tiny string. The fabric starts unraveling. Medical overtesting works exactly the same way. You get one scan, it finds a spot. Now you need another scan, then a specialist, then a biopsy, then maybe a procedure. Each step increases your actual risk. In medicine, we call this the cascade effect. One incidental finding leads to interventions that were never necessary. And here's the hard truth nobody talks about. After 60, your body will have wrinkles on the inside. Small cysts that have been there for years doing nothing. Tiny nodules that will never grow. Mild changes in tissue density. Finding them doesn't mean they're dangerous. But once they're found, they're almost impossible to ignore. The psychological weight alone can be crushing. You start researching online. You read worst-case scenarios. You lose sleep. Large population studies show something remarkable. When healthy adults over 60 undergo whole-body imaging, over 90% have abnormal findings. Over 90%. Let that sink in for a moment. Yet those same studies show no improvement in overall survival compared to people who weren't scanned at all. Zero difference. What did increase? Follow-up procedures. Anxiety diagnoses. Complications from biopsies and invasive testing. More detection did not equal longer life. It equaled more intervention. That's not prevention, that's escalation. That's taking healthy people and turning them into patients. And once you're a patient, once you're in the system, it's very hard to get out. So today, I'm walking you through 4 common tests that often trigger this cascade after 60. And the last one is the most controversial because almost everyone assumes it's always necessary. If you understand these 4 tests, you will never agree to a test without asking the right questions first. Now, before we go further, I'm curious, have you ever had a test that led to way more appointments than you expected? Let me know in the comments. We learn from each other here, and your story might help someone avoid unnecessary stress. Let's start with test number 4, whole body scans. These are being marketed directly to consumers now. You've probably seen the ads: executive health packages, preventive screening bundles. They sound appealing. The misconception is simple. If I scan everything, I'll catch problems early before they become serious. Sounds logical, right? But here's the reality. You'll catch normal aging changes. These scans almost always find small nodules or cysts in healthy adults. Most will never cause symptoms, not in 10 years, not in 20, not ever. But once detected, they require follow-up imaging. The radiologist has to cover themselves legally, then sometimes a biopsy, then sometimes surgery. Every single step carries risk. The research is crystal clear: no survival benefit in people without symptoms, but significantly higher rates of procedures. Think about what that means. You go in healthy, you leave with a care plan for something that was never going to hurt you. Now you're in the system, getting monitored, getting reminder calls. Your anxiety goes up, your quality of life goes down, all because you wanted peace of mind. Here's the practical insight. If you have no symptoms, broad imaging rarely improves outcomes. The common mistake? Believing peace of mind comes from more data. Often it creates the opposite. The more you scan without a reason, the more you find that shouldn't concern you, but it does concern you. Because it's there now, on paper, in a report. It has a name and a measurement. I've seen patients who were hiking every weekend, traveling, living fully. They got a whole body scan just to check. Found a small liver cyst, completely benign. The radiologist even said it's probably been there for 20 years. But now they're not hiking anymore. They're worried about jarring it. They're waiting for the next scan in 3 months. The cyst hasn't grown. It won't grow, but their life has shrunk. That's the real cost nobody calculates. And let me tell you what these scans cost beyond money. They cost you peace of mind. They cost you the confidence that your body is okay. I've had patients tell me they can physically feel their small kidney cyst, even though that's medically impossible. The mind is powerful. When we give it something to worry about, it will fixate on it. Let's move to test number 3, brain MRI for mild forgetfulness. This one hits close to home for a lot of people. The misconception here is deeply ingrained. If I'm forgetting names or where I put my keys, I need a scan to see what's happening. It feels responsible, proactive. Your adult children might even be pushing for it. They're worried. They've read articles about early detection of dementia. But here's what actually happens when you get that scan. Age-related memory changes show up as abnormal on MRI, even when your function is completely intact. The scan shows structural changes. Terms like cerebral atrophy, which just means your brain is slightly smaller than it used to be. White matter disease, which sounds terrifying. Vascular changes. These findings are common in healthy 70-year-olds, extremely common. If I scanned 100 healthy, high-functioning 70-year-olds who are living independently, probably 80 would have at least one of these findings. They're living normal lives, managing finances, traveling, having complex conversations. But their MRI looks abnormal by the standards we use for young brains. A better evaluation. Functional cognitive testing right in the office. A conversation with your doctor, drawing a clock, remembering 3 words. Many reversible causes of memory issues don't require imaging at all. B12 deficiency can cause significant memory problems. So can thyroid imbalance. So can medication side effects. Sleep deprivation is a huge factor. If you're not sleeping well, your memory will suffer. Stress and depression affect memory profoundly. Even dehydration can impair cognitive function. These are fixable, but when you jump straight to imaging, you bypass the simple checks. Then the MRI report comes back with phrases that make you feel like your brain is falling apart. Mild generalized volume loss, scattered foci of T2 hyperintensity. If you're not a radiologist, these phrases sound catastrophic, when in reality, you just needed better sleep and a vitamin supplement. The common mistake is confusing structural aging with actual disease. Your brain at 70 doesn't look like your brain at 30. That's normal. It's not pathological. Just like your skin changes, your brain structure changes, but function can remain excellent. I've had patients come in with MRI reports showing mild volume loss. They're convinced they're developing dementia. We do the cognitive testing. It's completely normal. They're functioning at a high level, working, managing complex tasks, remembering conversations. The MRI didn't help. It terrified them. Now they're checking themselves constantly. Did I forget that? Am I slipping? The scan created a problem where none existed. And here's another issue. Brain MRIs sometimes find things completely unrelated to memory. Small aneurysms, tiny tumors that would never cause problems, vascular malformations. Now you're dealing with those findings too. More specialists, more imaging, more decisions. All because you forgot someone's name at a party. Now we're getting into heavier territory. Test number 2, routine cardiac stress tests based purely on age. The misconception is embedded in medical practice. If I'm over 70, I need a treadmill test before any procedure or activity. Before surgery, before starting an exercise program. It seems like common sense, but here's the reality. If you can climb stairs without chest pain, your daily life is already a stress test. Every time you climb stairs, you're stressing your heart. Every time you walk briskly, carry groceries, play with grandchildren, you're stressing your heart. If you're doing these activities without symptoms, you're passing a stress test every day. False positives are extremely common in older adults without symptoms. The test shows an abnormality that looks concerning, but isn't causing any real problem. Your body has adapted. And false positives lead to cardiac catheterization, which carries real risks. Bleeding from the insertion site, kidney damage from the contrast dye, artery damage, even stroke, all from testing someone who had no symptoms to begin with. Study after study shows that routine stress testing in low-risk, symptom-free adults does not reduce heart attack rates. It doesn't save lives, but it does lead to procedures. The common mistake is testing risk instead of testing symptoms. If you have chest pain, shortness of breath, other cardiac symptoms, absolutely test. But if you're active and symptom-free, the test itself becomes the risk. I've seen this pattern repeatedly. Someone needs minor surgery, knee replacement, cataract surgery. They're healthy, active, no cardiac history. They walk their dog every day. They garden. But they're 72, so someone orders a stress test just to check. The test shows an abnormality, some ST segment changes that might indicate reduced blood flow. Now they need a catheterization to see what's going on. That finds a blockage in one of the coronary arteries, a 60% blockage. Sounds scary, but it's not causing symptoms because the heart has developed collateral circulation over time. The body adapted. Blood is getting where it needs to go. The person was functional, active, living life fully, but now it's been found. So they're getting a stent. The procedure goes reasonably well, but recovery takes longer than expected. They develop a bleed at the insertion site. Back in the hospital, they develop anxiety about their heart. They're afraid to exercise now, all from a test they didn't need. And here's what's insidious. Once you're in the cardiac system, you're monitored forever. More stress tests, more imaging, more echocardiograms, more appointments with cardiologists, more medications with side effects. when the original finding was something your body was handling perfectly fine. Your heart had adapted. You were functional. You were active. But now you're a cardiac patient. That label sticks. It changes how every future doctor sees you. It changes your insurance. It changes your self-image. You go from someone aging well to someone who's sick. And that shift has profound effects. Now we're at the big one, the test that people get emotional about. Test number 1, routine colonoscopies after 75 in low-risk adults. And I need you to really hear what I'm saying here because this gets misunderstood. The misconception is that more screening always prevents cancer. That if we just keep checking, we'll stay safe. But here's what the data actually shows. Colon cancer develops slowly, often over 10 years or more. After 75, the risks of the procedure start to outweigh the benefits, especially in low-risk individuals with prior normal screenings. Think about what low risk means. No family history of colon cancer, no inflammatory bowel disease, previous colonoscopies that were normal. At this point, your risk of developing a cancer that will actually affect your lifespan is very low. Meanwhile, the procedural risks rise. Sedation complications, dehydration from the prep, which can be severe in older adults, even colon perforation, which is rare but catastrophic. Guidelines now recommend individualized decisions. This isn't one size fits all. For many low-risk adults with prior normal screenings, continuing aggressive surveillance after 75 may cause more harm than prevention. That's not anti-screening. That's pro-balance. It's about looking at your specific situation and asking, what's the actual benefit versus the actual risk? I'm not saying never screen. I'm saying have the conversation. If you're 78, you're healthy active, you've had 3 normal colonoscopies, and you're scheduled for another one just because it's been 10 years. Pause. Ask your doctor, what's my actual risk here? What happens if we don't do this? What are the risks of the procedure itself? Those questions matter. The challenge is we've been conditioned to believe that more screening is always better, that stopping screening means giving up. But that's not accurate. Stopping unnecessary screening means protecting your quality of life. It means avoiding complications that could take away your independence. Because at this stage of life, independence is everything. Your ability to live on your own terms, to travel, to enjoy your family, that's what matters. I've seen it in my practice. A healthy 77-year-old, active, playing tennis twice a week, gets a routine colonoscopy, develops a perforation, emergency surgery, weeks in the hospital, infections, delirium from the anesthesia. By the time they recover physically, they've lost muscle mass, confidence, independence. They never get back to tennis. They move in with family, all from a screening test for a disease they had a very low chance of developing in their remaining lifespan. That's the calculus we're not having, honestly. We talk about catching cancer. We don't talk about the procedural complications that end independence. Both matter. Both need to be part of the decision. Now, here's what you'll notice almost immediately when you stop agreeing to unnecessary tests. Less anxiety. You sleep better before appointments. You have more confidence walking into medical conversations. That psychological relief matters more than people realize. Stress hormones affect blood pressure. They affect immune response. They drive inflammation. Reducing unnecessary medical fear actually improves your physical health. Your body functions better when you're not in a constant state of worry about what might be wrong. And let me be very clear about something. If you have symptoms, testing is essential. Chest pain, unexplained weight loss, blood in your stool, progressive memory decline. Real symptoms need evaluation. This is not about avoiding medical care. It's about discernment. It's about knowing when a test will actually help versus when it's just generating more questions and more procedures. The key question to ask your doctor every single time is this: how will this test change what we do? If they can't give you a clear answer that improves your quality or length of life, pause. Think about it. Get a second opinion if needed. Because once you do the test, you can't unsee the results. Once something is found, even if it's harmless, it's on your record. It's in your head. It affects every medical decision going forward. Here's the real reason people get trapped in overtesting: fear of missing something. That fear is powerful. It's driven by stories we hear. Someone's neighbor who didn't get screened and found cancer too late. Those stories stick with us. They shape our decisions, but we don't hear the other stories as often. The stories of people who got screened and found something that led to complications, or the stories of people who didn't get screened and lived long, healthy lives anyway. Those stories exist too, but they don't create the same fear. After 60, the bigger threat to your independence isn't undetected microscopic disease. It's complications from unnecessary intervention. I've seen this repeatedly in surgery. The original finding wasn't the problem. The treatment cascade was. Someone finds a small thyroid nodule on a CT scan done for something else. It's tiny, it's not causing symptoms, but now it's there, so we biopsy it. Biopsy shows some cells that look slightly abnormal. Not cancer, but not totally normal, so we do surgery to remove the thyroid. Now you're on thyroid medication for life. You have a scar, you went through surgical risk, all for something that was never going to hurt you. That's the cascade. And it starts with the first test. That's why the question isn't just, is this test safe? The question is, where does this test lead? What's the next step if we find something? And the next step after that, because each step increases risk. Each intervention has complications. And at some point, the cure becomes worse than the disease that never was. Protection at this stage of life isn't about chasing perfection on imaging. It's about preserving function. It's about making choices that keep you living the life you want to live. Because here's what really matters. Not the number on a blood test or the measurement of a nodule on a scan. What matters is whether you can do the things that bring you joy, whether you can travel, garden, play with grandchildren, live independently. Those are the outcomes that count. And sometimes the best way to protect those outcomes is to say no to a test. To say, I'm going to watch and wait. To trust your body a little more and trust the fear a little less, that takes courage. Because we've been conditioned to believe that doing something is always better than doing nothing. But in medicine, that's not always true. Sometimes the wisest choice is watchful waiting, observing, living your life, only testing when something changes, when symptoms appear, when there's an actual reason beyond just checking. For the next 30 days, I want you to try something. Before agreeing to any non-urgent test, ask 3 questions. What happens if we don't do this? What are the risks of follow-up procedures if we find something? Will this test improve my actual function or lifespan? Write down the answers. Don't just ask in your head and move on. Write them down. Because clarity changes everything. When you see the answers on paper, you realize how often tests are ordered out of habit, not necessity. How often they're done because that's what's always been done, not because there's clear evidence they help. Those 3 questions are your protection. They shift the conversation from automatic to intentional. They make your doctor think. They make you think. And that thinking is where good decisions come from. Not from fear, not from protocol, from actual thoughtful consideration of what helps you specifically. You are not fragile. You are not declining. You are experienced. You deserve medical care that respects your quality of life, not just protocols written for populations. You are an individual. Your risk is individual. Your values are individual. Your goals are individual. Cookie-cutter screening recommendations don't account for that. They can't. They're designed for averages, but you're not average. You're you. With your own health history, your own family situation, your own priorities for your remaining years. And here's something else I want you to understand. Aging is not a disease. It's a natural process. And part of that process is accepting that your body will change. that scans will show things they didn't show 20 years ago. That's not failure. That's not pathology. That's life. The goal isn't to keep your body looking like a 30-year-old on imaging. The goal is to keep your body functioning well enough to do what matters to you. Those are different goals, and they require different strategies. When you chase perfection on tests, you end up in a cycle of never-ending monitoring because there's always something to watch, always a number that's slightly off, always a shadow that wasn't there before. But when you focus on function, the questions become different. Can I walk? Can I think clearly? Can I enjoy my food? Can I sleep? Can I connect with people I love? If the answers are yes, you're doing well, regardless of what a scan might show. I want to be clear about something else. I'm not against modern medicine. I'm a surgeon. I've seen lives saved by early detection. I've performed procedures that gave people years they wouldn't have had. But I've also seen the other side. The side where testing becomes its own problem, where the pursuit of information creates suffering. And I think we need to talk about that side more honestly, because it's real, it's common, and it's preventable. The medical system is set up to do more. More tests, more procedures, more interventions. That's how it functions. Doctors are trained to investigate, to not miss anything. And that training is good when you have symptoms, when something is wrong. But when you're healthy, that same approach can backfire because the system doesn't naturally know when to stop. It knows how to escalate. It doesn't know how to de-escalate. That's on you. You have to be the one who asks if more is actually better, because often it's not. And here's what happens when you start asking those questions. You become a more informed patient. You start understanding your own body better. You learn to differentiate between normal aging and actual problems. You build trust in yourself. Because right now, we've taught people not to trust themselves. We've taught them that their body is a mystery that only tests can reveal. But your body tells you things. Pain, fatigue, changes in function. Those signals matter, often more than a test result that shows something you can't feel. I've had patients tell me they felt better than their test results suggested they should. And you know what? Their feeling was right. They were functioning well, living well. But the test made them doubt themselves, made them think something must be wrong even though they felt fine. That's backwards. Your lived experience of your health should matter more than a number on a page, not less. Now, I know some of you are thinking, but what if I miss something? What if that one test I skip would have caught something important? That fear is valid, but here's what I want you to consider. The risk of missing something has to be balanced against the risk of finding something harmless and treating it anyway. Both are real risks. We tend to focus on the first and ignore the second. But the second risk is significant, especially after 60. Because the things we find incidentally are often things that grow slowly or not at all, things your body would have handled on its own. There's a concept in medicine called overdiagnosis. It's when we detect a disease that would never have caused symptoms or death. Overdiagnosis is a real phenomenon. It happens with thyroid cancer, prostate cancer, breast cancer, and many other conditions. We find small cancers that would have stayed small. We treat them aggressively, and the treatment causes real harm. But the cancer never would have. That's overdiagnosis. And it's driven by overtesting, by screening people without symptoms, by finding things we weren't looking for. I'm not saying screening is always wrong. I'm saying it has to be individualized. It has to account for your age, your overall health, your risk factors, your values, and your goals. A screening test that makes sense at 50 might not make sense at 80. A test that's appropriate for someone with a family history might not be appropriate for someone without. These nuances matter, but they get lost when we apply blanket recommendations. When we say, everyone should get this test at this age. That's too simple. Health is more complex than that. So, what do you actually do? How do you navigate this? You start by educating yourself. You watch videos like this. You read. You ask questions. You bring someone with you to appointments to help you think through decisions. You don't rush. You take time to consider. You get second opinions when something major is being proposed. You trust that most of the time, watching and waiting is safe. Because it is. Most findings don't need immediate action. They need thoughtful consideration. And you build a relationship with a doctor who will have these conversations with you, who won't just order tests reflexively, who will sit down and talk through the pros and cons, who understands that at this stage of life, quality matters more than quantity. Those doctors exist. But you might have to look for them. You might have to change providers. That's okay. Your health decisions are too important to settle for someone who won't engage with your questions. Here's something else I've learned in 24 years of medicine. The patients who do best aren't the ones who get the most tests. They're the ones who stay active, maintain social connections, eat reasonably well, sleep enough, manage stress, and keep doing things they enjoy. Those factors matter more than any screening test because they directly affect your quality of life and your longevity. Tests don't. Tests just give you information. And information is only valuable if it changes what you do in a meaningful way. So before you agree to your next test, ask yourself, will this information change my behavior? Will it lead to treatment that improves my life? Or will it just give me something to worry about? Because worry has a cost. Stress is not neutral. It affects your body, your sleep, your mood, your relationships. Sometimes the cost of knowing is higher than the benefit. I realize this is a very different message than what you usually hear. Usually you hear that testing is good, that prevention means screening, that knowing more is better, and sometimes that's true, but not always, and the exceptions matter. Especially after 60, especially when you're healthy, because that's when the risks of testing start to outweigh the benefits. That's when the cascade effect becomes most dangerous. If this resonated with you, I have more to share. Next, I'm breaking down something equally misunderstood, the one medication class that quietly causes more fatigue and falls after 65 than most people realize. It's prescribed constantly, and it's rarely discussed as a problem. Make sure you're subscribed so you don't miss it. And if your goal is staying strong, sharp, and independent for as long as possible, check the description below. I've linked my longevity guide there. It covers the strategies that actually work to maintain function as you age, not the testing cascade, the real strategies. Thank you for watching. Thank you for being willing to question the standard approach. That takes courage, but it's worth it. Because your health is yours, your body is yours, and you get to decide how you want to approach these years. You don't have to follow protocol just because it exists. You can choose what makes sense for you. And that choice, that agency, is powerful. Use it well. I'll see you in the next video.